Typically, this is where we show you the hospitalization numbers each night for an idea of how many serious cases we have. But it appears that that measure of the pandemic is becoming about as useless as case numbers, and here's why. Last night, you heard UC Health say on this program that only about a third of their COVID patients are hospitalized solely for COVID. So we have to rethink our approach to holding hospitalizations up as the best measure of the severity of the pandemic in Colorado. We know the leading variant is less severe and more easily transmitted. So when you've got the majority of people in UC Health system there for something other than COVID, when they're COVID positive, that's pretty important. Though we have to keep in mind, those patients still do need specialized care. Here again is state epidemiologist Rachel Hurley on that.
Even if someone has a primary diagnosis of something other than COVID-19, COVID-19 is still complicating their hospitalization for a variety of reasons, either making them more ill and extending the length of their hospitalization, or making it more challenging for our healthcare providers to provide care to those individuals.
So you got people who are in for like a broken arm, but if they come back hot for COVID, then they have to be isolated from other patients. That takes hospital resources, straining the system with the number of staff vacancies. Long way of saying it's clear that we can't keep putting up the hospitalization numbers each night and comparing them to, say, 6 months ago, because it's no longer an apples-to-apples situation. It's why we're going to start focusing on hospital capacity, hoping that this is a useful measure to tell us the seriousness of the situation. So you look at ICU beds. Right now, there are 122 ICU beds available in Colorado, so 92% of ICU beds in Colorado are currently occupied. You don't want them all empty. That's not how hospitals are built, but we have to be careful it starts to get right up at the top side of the range.